Welcome to my YouTube channel, where I share my knowledge and expertise in Dr. Han's balance method acupuncture. Through my channel, I aim to help you to enhance your skills and deepen your understanding of the balance method. Hi, I am Dr. Eileen Yue-Ling Han, licensed acupuncturist with over 20 years of experience in the field. Please check out my website and the description down below to learn more about our online courses and take the first step becoming a much effective and knowledgeable acupuncture practitioners. Please enjoy my videos. Thank you.
Alright, you can be YouTube famous. Alright, good. Can you tell everybody a little bit about what's going on with you?
Yeah, I was diagnosed with POTS. I had like a rough pregnancy and COVID during pregnancy, developed it then, but I have a weird version of hyper POTS. So I overproduce noradrenaline and dopamine, so I feel like really awful and wired from doing very basic things like standing. But my blood pressure changed. So if I walk like a mile, it goes from like 115 to 85, but like constantly. I can kind of see a trend of this like developing over time of like having a really sensitive nervous system, having a handful of like sports related concussions that started to kind of like tweak my nervous system. So I have like a GI component to it, like diarrhea, but I'd say that the main concerns are like brain fog and like kind of that sensation of like there's not enough like energy and blood getting to my head and heart, and the low blood pressure, but I also get the like wired but tired feeling. So my adrenals are kind of messed. Anyways, I think it's all kind of related. It's sort of like a dysregulation of the nervous system.
And she also very, very busy at her job. And she work
Very stressful.
hard. And she travels 16 times a month to go to the Northern California, 16 or 14 times.
So 16 times in 16 weeks.
Yeah, so she really travel a lot.
I'm on maternity leave. So
Right.
I had a baby 4.5 months ago.
So now
that made it it was a beautiful pregnancy, but the childbirth, everything kind of like all of a sudden my POTS got really worse because all of a sudden I had less blood volume, I had childbirth, and so my body's just so dysregulated.
So part of the thing that I was thinking is because of the childbirth, because she gave all her energy to the baby, about 1/3 of her, so that really depletes you. And also before that, and she also went to India some time ago, and then she had that respond with the gastrointestinal problems. And every time you go, you have it, right?
Yeah, I went 5 or 6 times in grad school. I finished grad school maybe 6 years ago. But one time I got really sick. I developed gastroparesis and I had to go to the Mayo Clinic, and it took like 18 months for the muscle to heal. But the interesting thing about it is like gastroparesis is also just a nervous system disorder. So it's kind of like, it seems like when my body is taxed, that's like what is.
So everything hits the same time, basically, because she was tired, she giving birth. So I was asking her that she was standing for how long that you feel that your blood pressure drop?
Like 10 minutes.
10 minutes. So after the first 2 treatments, how you doing until today? Because in between right now is Wednesday, Thursday, Friday, Saturday. Today is Sunday. So 4 days in between. Did you feel like you go back to where you were now, or you have some sustain of the results?
I would say I was pretty good with energy. What's interesting is I was able to stand for a long period of time.
How long?
Probably like 30 minutes.
Yes. Yeah. Okay.
But what's interesting is it really surged the like adrenaline. So I overproduce adrenaline. We don't really know what to do about that.
Right.
And so that has been.
What kind of sensation you feel when you have that?
I get like twitches all throughout my body, and tightness in my chest.
Okay.
And just sort of like it kind of feels like you're in panic, but it lasts for like hours and hours.
Okay. Okay, we can do that. All right.
But yeah, so I think it's like my goal is to be able to like walk and stand more and be more physically active without my blood pressure tanking. So get those blood vessels to just kind of tight, when I stand, and then also be able to get my adrenals to not overreact to stimulus.
Okay.
Yeah.
Or just put the needles in the body will do the regulation, right? You know that, right? You guys all understand what I'm trying to do here. I can't go in there to fix everything like that because the body knows better how to help, how to support. So my job is to make sure that I do this correct strategy to control the heart, because one of the initial for the POTS is the tachycardia. Is that correct? Right?
Yeah.
So if we can control the heart, then I can do almost everything for everybody. So that's why I gave her the herb. Number one, I use the 炙甘草汤 because that can regulate the heart. And the second one is 龟皮汤 for the lady who just giving birth to strengthen her system. 龟皮汤, right? We need to strengthen her. And then 桃红四物汤 to make sure her blood circulate. There's no more stagnation in her system, so she'll be able to work beautifully. That's the reason why I gave her the herbs. So now you know why yesterday I gave you the herbs. So now you know why I use them. Okay? 四物汤 will be the best for a woman, and 桃红 because I need to move the blood. Sound good? All right, now can I see your tongue, please, real quick? Very good. All right. So still need to rest.
Yeah.
Okay. Good. So now, can you go into that room over there? There's a table. All right. So I didn't ask the doctor to treat you, but I'm gonna treat you this because I haven't teach them how to treat the heart yet.
Okay.
Elbow up. Thank you.
Thank you very much.
Oh, you're welcome. Of course. So they can learn anyway. So that's a good thing. Okay. You. Down. Okay. Are you guys okay to see the outside and inside all together? Good. Perfect. You're doing a great job. Did you see that? All right. Now. Okay. So number one thing that we're gonna do is we're gonna treating her heart. And once her heart regulated, everything should be normal. Your neck and shoulders very, very tight. Should we treat that too?
If you have time, sure.
Of course. All right. The first thing we're gonna do is treating the heart. So Dr. Tan always use the left side of the pericardium 6 to treat the heart. Okay, so now you can see that's right there. Ooh, good one, huh?
That's a good one.
1, 2, 3. Okay, so you don't just put in one needle. That might not be enough. Lung 7, heart 5. That covers in the UB neck and shoulder, and then the gallbladder neck and shoulder. Agree? Ah, beautiful. Stomach 36, deep insertion, treating the heart. Remember, I will put you 2 needles. I want to make sure to be strong enough for her, because that's her own issue. Is that UB57 is with the head, neck, and heart. Agree? That's the heart. Spleen 6 is the heart. Right? Head, neck, heart. Spleen treats the stomach, heart. So I'm going to put 2 needles there. And then her energy is low. I'm going to do kidney 247, tonification of the kidney. This is the balance method of treating the 5 element. Okay? Liver 1, 2, 3. This is the seasonal treatment. Also can be the tonification for the system. For the liver 1, 2, 3, we change it to Thai Gua. So all I'm doing is the advanced track stuff. So you just copy it when you go home. This will work. So I cover spleen, kidney, and liver. I treat all meridians. All right. Now I'm gonna do this right here. So right here, this is the metacarpal bone. And this is the head. So this is the heart. So large intestine 3 is the heart. Put the needles in right here. And then lingual. I want to make sure her lower back. Remember the adrenaline? She has a lot of that. So we don't want it. So we want the lower back to fix it, which is where the kidney is located. So I'm going to do kidney. This one 灵骨 and then 腰痛 5. All right. Also, 手颈 5 is also the head, the neck, the heart. So I'm going to do not only this one for the heart, I'm going to do the other stuff to take care of her neck and shoulder, plus the heart. So I'm going to put a few more needles in. So that is the heart. Neck. Do you see the bone? That's the head. This is the spine. So then you can also use this to treat as the heart. I usually don't do small intestine 3. I just don't like that point. Okay. All right. Now, I'm going to put the needles in her ear. I'm treating her heart again. Ooh, good one.
That's a good one.
All right. So same thing on this side. Treating the heart.
Is it Sherman and Hart?
Yes, 神门. I want her to sleep good. Can I remove this?
Yes.
And 印堂. That's it. This is Dr. Tan's 12 magical point. I modified it a little bit so you can see how I strategize this treatment. Very good. Let's cover her and then invite her mother to come in. So we're gonna put your mom next to you, okay?
Sounds good. She's kind of lost her voice.
Oh. What happened? She got a cold or something?
She's had a cold for like since Christmas, like 8 weeks.
Oh.
And then it kind of like just like ebbs and flows. Courtesy of having grandchildren with them.
Yeah. Whose grandchildren? Not yours.
Yeah, not mine. Mine are perfect.
Okay, I know.